All right, so for this video, I'm gonna kind of combine, we're gonna do circumduction, hip hike, and vaulting. So before we look at all three of those gait deviations and what you may actually see, I kind of want to talk about some other reasons why you may see this. Or I should say one specific reason. So one reason could be because somebody has a longer leg length. So let's say the right leg is longer versus the left. If the right leg is longer, they're not going to be able to normally bring that leg through to step because of the leg length difference. So if my right leg's longer, when I step, I'm going to have to compensate in some sort of way to be able to fully clear that foot. Otherwise, I'm going to either have a toe drag or I'm just simply not going to be able to clear that foot successfully. And there's a lot of reasons why somebody may have a leg length discrepancy. We talked about this in 102 on how to measure that leg length discrepancy, but we didn't really go into some of the details as to why they may have a leg length discrepancy. A true leg length discrepancy, sometimes you'll see these after a total hip or a total knee replacement. You'll see an increase of that discrepancy before and after. Sometimes it's just congenital. Some people have a longer femur on the right side versus the left side, or tibia, or vice versa. So a couple different reasons why you may see this. So let's first look at a hip hike. So the hip hike, we talked about it in 102. If you remember, we had our patients perform a hip hike to activate that quadratus lumborum. So how do we see this presented in a gait? So let's say I had my left leg is going to be doing the hip hiking. So before I start walking, remember that hip hike is when I actually bring that pelvis up and then back down. So walking, you might see a hip hike up, back down, and then they come through. Up, back down, through. Up, back down. Now, from this view, you may not see as much since it's my left leg that's hip hiking. Forward view, hike up, back down, hike up, back down. Notice as I'm hiking my hip up, my knee isn't doing a whole lot of bending. I get a little bit maybe as I start to get into that stance phase, but there's not a lot of bend in that knee during the hip hike. Now, it could be from a leg length discrepancy, but with that hip hike, remember we talked about the Trendelenburg test and that glute med being weak. That could also potentially cause a hip hike. There's so many reasons for that. Next, then we have hip circumduction. So circumduction, which usually happens at the hip. So when we think of circumduction, we think of something going in a circular pattern. Now again, this could be caused due to a leg length discrepancy. I see this a lot in the clinic from an outpatient perspective when somebody's in a long leg brace. So if they're in a brace, from the hip down to the ankle, whether that was an ACL repair, a tibia fracture, patella fracture with an ORAF, so many reasons for somebody having a T-ROM like that, but that may also cause a hip circumduction gait pattern. So the way that you would see this, actually I'll give you a frontal view here first, is if it's my left hip, you're going to see them kind of swing the hip out to clear. Now, with the circumduction gait, almost 9 times out of 10, you won't see that knee bend. So you won't see something like this. Now, you could, it would still be a circumducting gait, but typically they're doing this, again, that leg length, or if they have a long leg brace, that knee is going to be locked into extension. So they're not going to be able to bend their knee. So you're going to see a circumducting gait pattern. From a side view, you're going to see that come around and back, around and back. Still the left side that's circumducting, coming around and back. Some people also may just have a circumduction gait if they have really tight hips. if that hip is automatically in an externally rotated position, they're going to usually kind of swing that hip. And a lot of times they don't even know it, which is our job to try to correct that gait abnormality. All right, and then we have vaulting. Vaulting is something I would say you don't see quite as frequently compared to the circumduction or the hip hiking, but you could definitely see this. Now, a lot of times, again, this is that leg length discrepancy where you'll see somebody vault. So when you think of vaulting, what's happening is they're trying to propel and get momentum to bring that leg up and out. So that's kind of the key to differentiate, are they hip hiking or are they vaulting? So I'm going to kind of exaggerate to make sure that you see my feet. And looking at this left leg, when I vault, it's going to be during my stance leg. I'm going to come up and I'm trying to push and get momentum to go into the next step. So left leg, I'm going to vault, push up, push up, push up. Notice the vault. I'm going to do that vault one more time, and then I'm going to show you the hip hike and see if you can see that difference between the two. So when I vault, see how my whole body, and I know I'm kind of exaggerating on this, but my whole body is coming up into that vaulting position. And then look at my stance leg. That stance leg is going up on the toe to get that leg up. When I go up on that toe, I'm getting myself, another inch or 2 inches to be able to clear that hip. So that was the vaulting, and then kind of circle back to that circumduction, hip hiking. When I hip hike, look at the stance leg, my right stance leg. See how that remains flat? One more time, the hip hike, up and back down, up and back down, and then the vault. So I'm pushing up, going up on my toe to try to clear that leg. So there's a very distinct difference between those two that we should be able to identify and correct with our patients and in the lab.